offers, its directors and employees assume no responsibility for the accuracy, completeness, objectivity, or usefulness of the information presented on our site. We do not endorse any recommendation or opinion made by any member or physician, nor do we advocate for any treatment. You are responsible for your own medical decisions. Now, I'm going to turn over the introductions of our speaker to Martha Butterfield, the webinar coordinator of NJCTS. Marty?
Thanks, Kelly, and good evening, everyone, and welcome. Thank you for joining us. Before I introduce tonight's presenter, I'd like to call your attention to a couple of things that have upcoming deadlines. For over 10 years, we have awarded over 200 scholarships to graduating New Jersey high school seniors who have Tourette syndrome and are continuing their education at either 2- or 4-year college programs. Additionally, over these 10 years, we have been accepting nominations for Educator of the Year. These nominations, submitted by parents and/or students living with Tourette, bring much-deserved attention to educators who have made a difference in the life of a child with TS. Deadlines for both of these programs are May 1st, and applications can be found on our website. And finally, our next New Jersey Walks for TS event will be held on March 29th in Mercer County Park. We hope that you'll attend. If you can't, please go online and make a donation in support of our scholarships, peer advocacy, and education outreach programs. Now to the introduction of our presenter, Dr. Michelle Miller. Dr. Miller received her BA from Clark University in Massachusetts and her Psy.D from the Graduate School of Applied and Professional Psychology at Rutgers University. She's currently at Rutgers, where she supervises clinical and psychology grad students in cognitive behavior therapy and psychological testing. Dr. Miller is also a postdoctorate fellow in the Rutgers Tourette Syndrome Clinic. Additionally, she specializes in cognitive behavior therapy for youths living with Tourette syndrome, obsessive-compulsive disorder, and trichotillomania. Dr. Miller has been trained in the application of evidence-based treatments for a wide range of other psychological problems, including, but not limited to, depression, trauma, specific phobias, as well as oppositional, aggressive, and self-injurious behaviors. She is a New York State licensed clinical psychologist who is a clinician at Therapy West, a group practice in Manhattan. There, she has worked with children, adolescents, and adults in a range of settings, including inpatient programs, psychiatric emergency departments, residential treatment facility, and different outpatient programs throughout New York and New Jersey. Dr. Miller, welcome. We are delighted to have you join our webinar family. And now, without further introduction, I'll turn tonight's program over to you.
Hello. Good evening, everyone. Today I'm very excited to speak with all of you about sensory issues and managing them both at home and in the classroom. Now, so many of the children that I work with struggle in this area, and I often see the confusion with parents, teachers, as well as other professionals on how to deal with this. And I hope that by the end of this presentation, you'll not only understand sensory issues themselves, but also about what interventions can be done to help them. And now the brain is amazing in so many ways. It has a big job of taking information from the outside world and making sense of it. When our senses are strong, we're in touch with this information, able to process it well. But if you sit and imagine what would happen if that ability went haywire, that's when sensory problems come in. Now, unfortunately, although you've heard of sensory problems, you've likely never heard of an official term. And that's because there's no diagnosis or official definition for sensory problems that are recognized throughout medicine or psychology. And that's a big deficit in our field. This is relatively new, the research on sensory issues. It's only in the past century that we started to really look into sensory problems. And that's primarily due to the amazing pioneering work of Dr. Aris. She was an occupational therapist, psychologist, and researcher, professor, and so much more at the University of Southern California until her death in the late 80s. Her work was focused on understanding sensory issues, and she was actually the first person to give it a label. She coined the term sensory integration dysfunction in the 60s. And when you get through the end of my PowerPoint, there are some sources to find out more information about her as well if you're interested. The term sensory integration dysfunction, though, I want to clarify, that's not commonly used today. More often what you would hear, if you do hear a term, is sensory processing disorder or sensory modulation disorder. This is in large part due to the work of Dr. Lucy Miller, who had studied under Dr. Aris. And Dr. Lucy Miller has been in the field of understanding sensory problems for over 3 decades. She's a professor currently at the University of Colorado in Denver, and she's the founder and director of the Sensory Processing Disorder Foundation. She also is a major researcher in the field and does a lot of advocacy for us to be more educated on sensory processing disorders, to do more research, and also she's worked in psychology and medicine to try and get official diagnostic labels. Now, if you look at this slide, this image encompasses her theory and the labels that she gives. You can see there's this large umbrella term of sensory processing disorders. But I want you to focus on the left side. So if you look over at sensory modulation disorders, this is going to be the focus of the presentation, as when you're thinking of, since this is what you're thinking of when you think of sensory problems. And then there's these 3 conditions: sensory overresponsivity, sensory underresponsivity, and sensory craving. So to go into this more, there are different types of sensory problems specifically. So individuals with oversensitivity, these are people who take in too much sensory stimulation. They overprocess information from the outside environment. It feels overwhelming to them, and it can trigger a fear or threat response as they're getting overwhelmed. And then they respond with aggression, with fear, avoidance, or withdrawal. It feels like an attack to them on the outside, so this is why they present with these behaviors. But of course, you don't see what's going on internally, you only see the external behavior. So an individual who sees this can become concerned. On the other hand, are individuals who may experience undersensitivity. Now, they don't take in or recognize sensory stimulation as well, and so they come off as more apathetic as their brain is processing sensory information. And last are sensory seekers. These are individuals, they crave sensory stimulation. They're actively seeking it in their environments. The one thing, though, I want you to keep in mind is that you can actually have a combination of all these. So you can be sensitive seeking with auditory information, but oversensitive with visual information, or oversensitive with some tactile information and undersensitive with other tactile information. The other person I want you to know about is Dr. Winnie Dunn. She's another key person in the field, and the third and last person I'll be talking about. She's currently the professor and chair of the Department of Occupational Therapy at University of Kansas. Her background is in occupational therapy, special education, and applied neuroscience. She has published extensively in the field, including creating the sensory profile measures, which are commonly used by occupational therapists. And if you look at this slide, this presents her theory in understanding sensory problems as related to two areas. So the first thresholds that come first, she looks at two areas. First, the thresholds, that people either have like a very high threshold for sensory information, and it takes a lot of sensory information for them to process and to feel like they're getting input from the environment. And then there are other people who have more of a low threshold for sensory information, and very quickly it feels overwhelming to them. And then on the other side, people approach their threshold either passively or actively. So, for example, the sensory seeker has a high tolerance, and they actively pursue sensory input, while the sensation avoiding has a low tolerance, so they're prone to getting overwhelmed and actively avoid sensory information. Now you can see how some of these areas in the table reflect similar areas in Dr. Miller's theory. So the sensory avoiding and sensitivity reflect the oversensitive child, while the low registration reflects the undersensitive child. The sensory issues can be experienced in any of the five senses, as well as vestibular and proprioceptive. And I'm going to explain those last two terms shortly. But I want you to keep in mind that while each individual presents with a range of different sensory problems, and no individual is quite the same, there are some common themes. So common sensory issues that are reported by parents are sounds of alarms that feel overstimulating to children. Many kids, they report, are bothered by tags on clothing, by cutting nails, by wearing socks, hair brushing, wet clothes, seams on clothing, people standing too close, and sirens. Nail clipping is also commonly reported as well. The vestibular, so now I'm going to go to vestibular sensory problems. This refers to body orientation, relationships to the ground, movement, and balance. So if you imagine an individual who's oversensitive in this area, how would they present? Well, they don't like the ground that's uneven or moving, and may be more prone to motion sickness. On the other hand, the undersensitive don't have that insight and seem unaware of heights, which is clearly a safety concern, and they'll need more supervision. Sensory-seeking children are actively trying to get vestibular stimulation. So they love heights, and they'll enjoy things like roller coasters and water slides. And so it's very clear, much more so for a child who's more sensory-seeking. Proprioceptive sensory issues occur due to deficits in body awareness and motor control. If they're oversensitive, things like deep pressure touches are very uncomfortable, as well as activities that involve a lot of body movement and control, such as dancing and gymnastics. Undersensitive children, they may be more clumsy. And sensory-seeking children actively pursue more awareness towards their body, such as squeezing objects, running, jumping around, and at extremes, they may be even engaging in self-injury because they're so desperate to get that sensory information and get that input. In contrast, our five senses are more often described when you hear about sensory problems. If someone has a visual sensory problem, you might expect them to feel overwhelmed by a very detailed image or light, while if they are undersensitive, their depth perception may be limited. Auditory oversensitivity. In that case, someone would get distress from from everyday noises, such as vacuum cleaners, and even loud voices. Now, the loud voices becomes a big concern when a parent has a loud voice. The parent wants to speak to their child, but whenever they do, their child is on the edge or distressed. If the parent doesn't understand that it's due to their voice, they won't change, and it can harm their relationship. So this is a major issue of how sensory issues can be harmful. If you think about how that might affect a relationship, a parent goes to speak to their child and they want to connect with them, and then their child gets distressed as they are getting overwhelmed by the loud voice. And the parent, of course, doesn't realize this much of the time and feels that it's something else that they're doing or something wrong in their relationship. Similarly, children with tactile oversensitivity may struggle with relationships if they're distressed by human touch. If you imagine what it's like to be sensitive to things like toothbrushes, hairbrushes, and clothing, you can also see how the daily routine that we take for granted are so stressful for these children and their parents. Tactile sensory-seeking children also struggle too, because at times they may touch other people too much or touch objects too much. And sometimes even when they're younger, putting things in their mouth too much. Taste sensitivity is a big stressor for parents and their families and children. This is when children may not be able to tolerate certain textures, flavors, consistencies, and temperatures. Parents understandably get upset when they see their children refusing to eat, so it's not uncommon that regular arguments begin to ensue around the dinner table. And then children get more stressed and oppositional, and it can become a tug of war. And they may even, when new foods are introduced, they start to become anxious just in anticipation of maybe certain textures or foods that they may experience, as well as potential arguments with their parents if they refuse to eat them. Now, I have a young girl that I'm treating right now who has a number of food sensitivities, and she becomes particularly distressed around new foods and combinations of certain foods. And then there are many foods in general that she just won't eat. So at this point now, dinner time comes along, especially going out to eat, and then there's a tug of war with her parents, and it becomes a very stressful event. So to help them, what I've been doing in session is gradually introducing the girl with her parents in the room to small amounts of food, and she chooses how much. and these are new foods for her, or new combinations of food. And then when she tries it, she gets a lot of practice, a lot of praise from her mom, and praise from myself, and a lot of excitement. She also gets a prize. So it becomes more fun for her and less stressful, and that's been very helpful. So as I said before, the research on sensory issues has a long way to go. It's still in its infancy. Many of the population samples in the studies are pretty small, and it's often focused around autistic spectrum disorders. The measures that they use in these studies are not consistent, but hopefully with people like Dr. Lucy Miller and Dr. Dunn, this area will start to progress. From the data that we do know that somewhere around 5 and 16% of children have a sensory processing disorder, and that number goes way up if you look at children with disabilities. And these issues are often noticed pretty early on by parents. One study found that on average, parents notice this in children around the age of 5. There's also evidence, too, that there's a genetic link. There was a study that looked at identical and fraternal twins and found that sensory problems were significantly more likely to occur between 2 identical twins than for both 2 fraternal twins to have them. There's also likely a neurological component, as it's common in a number of disorders such as Tourette syndrome, ADHD, OCD, autism, intellectual disabilities, and even in schizophrenia. There's no common thread of how these sensory issues present in these conditions, but we're getting some more information about how they relate to each other. So for example, children with ADHD and sensory problems are more likely to have anxiety and aggressive behaviors than children with ADHD and no sensory problems. Beyond the research, many of you out there who've signed up for this are signed up for this webinar because you've seen firsthand about how these issues affect children. Without feeling in control of how they respond to their environment and the constant threat of overstimulation, they start to feel more depressed, they're more prone to anxiety as well, low self-esteem, and they don't have that sense of mastery. They often, with their sensory issues, especially if it's more around their body orientation or body awareness, they may not engage in many activities or engage in them inappropriately, and this can cause them to fall behind in their development. They're also more prone to social skills problems, which leaves them more likely to feel isolated, to have less friends. And then as others can't see what's going on internally, that they're having these reactions of distress, because they're getting over or understimulated, they may be perceived as lazy or as oppositional, even though they're struggling with these sensory problems. And the labels that they get can really hurt them emotionally. Now, we don't know for sure how sensory issues progress over time, only that it does seem that it's more common in children than in adults. But adults there are a lot of adults out there who have sensory problems and they're struggling through. Over time, they seem, from what we know in research, to learn some coping skills, such as talking themselves through sensory problems or avoiding them. They don't get these coping strategies. They're just coping with the issue. They're not really getting at the underlying problem. And many of these adults don't get into treatment with occupational therapy. But we do know that they can benefit from what's called a sensory diet, And this can help them out tremendously. So occupational therapy is a key to supporting children and adults. These individuals are specially trained to handle sensory problems. They can conduct a thorough evaluation from structured measures like the practice tests, as well as using parent interviews, talking with teachers, and using their own clinical observations. And then from the information that they get, they can create what's called a sensory diet. And this is an individualized plan around sensory exposure that's designed to support an individual's sensory needs. So, for example, a child who's oversensitive to the feeling of sand may be asked to stick their fingers in a sandbox and dig out toys that they would like to play with support from their parents. There is no standard protocol for occupational therapy. However, there is more research that's being done to study different interventions and what might be effective. The research that we have right now on specific protocols is pretty limited. And you can, if you're interested in occupational therapy, you can find referrals to a number of different websites, including the website for the Sensory Processing Disorder Foundation, and I have that towards the end of my slides. Now, psychologists like myself, as well as other mental health professionals, can also help in big ways, in particular to support the anxiety, depression, and self-esteem issues that occur so often in this population. We can also help support the parents in advocating for their children and help families understand what it means to have sensory problems. I would also like to note that some treatments we do with these children are also similar to what's done in occupational therapy, particularly what we call exposure to the feared stimulus. Now, for example, I was treating a young girl around the age of 6 a few years ago. She was struggling with anxiety and multiple sensory problems. She was overstimulated by a lot of loud noises, primarily flushing and hand dryers. And this was even worse when they were automatic, since that's unexpected and unpredictable in so many ways. And someone could suddenly walk back past a toilet or past a hand dryer, and it would turn on and scare her. And these things I didn't even realize until I had this case. They're common in public restrooms. So for those of you who are parents, if you can imagine the stress of having a young child who completely avoids public restrooms at all costs, and what it would be like on vacations, on going to the mall, on going to restaurants, it makes things very stressful. So it's really important that this issue be addressed as soon as possible. So what I started with is teaching the child relaxation skills, just like deep breathing, getting at anxious thoughts so she could feel more comfortable in getting herself relaxed. And I had her practice these strategies at home with her parents. And then we would go in session, and we would go to nearby restroom that had automatic flush toilets, and we would get as close as possible to the toilets without her getting so anxious that she would completely feel like she couldn't handle it, would run away. So we would just get a little bit closer each time until she started to feel more comfortable, and then she would practice standing in that area in other public restrooms with her family during the rest of the week. So, you know, the first session when we were doing this exposure work, she was only able to stand in the bathroom doorway. But by the end, she was able to sit down on an automatic flush toilet with no problem. And it was very effective because at the end of the treatment, her problem was eliminated. She felt more confident and happier that she had conquered this issue. And her parents were, of course, really happy that they didn't have to figure out what to do if they were in the middle of a mall or away and there was only public restrooms with automatic flush toilets or hand dryers. There's a lot that parents can do too at home. So as it's very stressful for many parents dealing with this, I really want to note that there are parent support groups online for individuals dealing with this. And so I provide an example online from the Psy.D Foundation. Some of the best things that you can do too as a parent is making sure their environment is as structured, as predictable as possible. These children feel like they don't have mastery over their environment, so if you can help them feel more controlled, that can go a long way. So for example, providing a clear schedule, having a calendar of events on the wall, telling them ahead of time when a sensory event is coming up. And a big thing is giving them cues of a social situation. For example, if they're about to go to a party with other children, you might want to let them know what you would say to other children when you greet them. If they ask them questions, maybe how far they should stand from them. How they touch with them, how to touch, if they want to give the child a hug, what to say, more of that structure. And you also want to observe them in social situations to see where their strengths and weaknesses are and where they may need more supports. And if you know that they're going into an event, sensory event, like let's say they're bothered by the texture of sand and there's going to be a playground with a sandbox, let them know ahead of time so they can prepare for that. For tactile sensory-seeking children, you may want to help them get support with physical boundaries, such as reminding them to ask someone for a hug if they're more sensory-seeking before they may go in for a hug, because some of these children, it's hard. They're out there really seeking the touch of other people, and it's hard for them to know the limits. You want to take also careful notes and observations of what you notice going on with your child in the sensory realm to better understand their needs and get that information across to other professionals that work with your children. I'm going to talk with you today about different sensory techniques that can be done at home. But before you try anything, I strongly recommend you first consult with a professional like your pediatrician, occupational therapist, to ensure that it's the right fit for your child. And it's also very important that when you're using any techniques, you're giving your child more sensory information, that you respect their boundaries. You don't want to push them to the point that they're getting really distressed. And if they do get distressed at any time from sensory input, you want to have a place for them to calm down that's not over or understimulating. When you try to have your child get into new sensory information, you want to also make it more of like fun. So try and turn it into game and maybe even having a reward at the end. There are many parts of the daily life of your child that you can utilize to make it more of a sensory-rich environment for them. So, for example, having a lot of toys, different types of soaps in bath time and bubbles, that's a great way to increase sensory exposure. And it's fun for them too. When you cook, have them help with mixing ingredients, with playing with the dough, with carrying pots and pans, cleaning utensils with the soap and water. At the dinner table, maybe having some different food out there, and just put it in small amounts. Don't make it a ton of food so it feels overwhelming to them. And if they're able to challenge themselves with any of these sensory issues, give them a lot of praise, a lot of positive feedback. You can even offer fun rewards, like something fun they can do if they challenge themselves. But again, don't push them. And you can even help them, and I'm sure many of you would love to have this, help them around with chores around the house, vacuuming, gardening. There's a lot of sensory input that comes from those activities. Now here I have a number of other things that you can do for oversensitive, undersensitive, and sensory seeking problems. So for example, with noise, if it's a sensory seeking child, have them learn to play an instrument that can be really stimulating for them. If they're oversensitive, on the other hand, playing soft music would be better. Sensory seeking is ideal for having them learn to play an instrument. And if they're undersensitive, with auditory information, you want to get them stimulated, so maybe briefly playing them loud music. And then with more proprioceptive, sensory-seeking children, you can work with them to create a safe obstacle course around your house. And movement games like the hokey pokey and ring around the rosies are really great for oversensitive, proprioceptive children. One technique that's commonly used with occupational therapists with children who have sensitivity to like foam like materials is if you give them like shaving cream and they have to finger paint with that. And for the teachers, there's so much that you can do to support these children as well. You want to also, like the parents, make things structured and predictable. Like I mentioned when I was talking about things to do at home, using organizational tools like calendars and planners are great. Any social skills support that you can give at school is really important. So if you can make social events more structured, if you can provide them with expectations of upcoming social events, how they should act around other children, be sure to monitor how they are with other kids if you know that they have sensory problems. And some of these kids may benefit from a social skills group, which are found in a number of different skills. A great thing is that occupational therapy can be provided through school. If your child qualifies for it, you can get an occupational therapist evaluation on the outside or go through special education to get support from the school. But the thing to keep in mind, though, is there's no mandate on how often or how occupational therapy is done in school. So you'll have less control over how that is in the school setting than if you saw an occupational therapist in a private practice. But the great thing is if it's done in the school, there's a lot of automatic collaboration between occupational therapists, between the teachers, between the school psychologists, and it helps make communication easier in that way. You want to also make sure for these, as a teacher, that there is a space for them to calm down where they're not over or under stimulated, and that you, of course, knew about the child's individual sensory needs. So it's helpful as a teacher if you can be in communication with parents and their occupational therapists about what's going on. If you notice any concerns of sensory issues, of course, let parents know, as well as if you find something that they're doing in school that can be helpful. It's really important to be in communication with their parents about this. And maybe they're doing something at home or with an occupational therapist that you'll learn about that can be done in school easily. As I mentioned before, these kids often feel poorly about themselves and may struggle with self-esteem. So giving them a lot of praise, finding them their strengths, letting them know what they are, be sure to catch them being good to help build up that esteem. So if from all this information that I'm giving you, if there are just a couple things that I'd like you to take home, these are them. So the first thing that I'd like you to keep in mind is that you are not alone. There are many adults and children who struggle with sensory issues every day. You want to learn as much as you can about your own, if you're an adult with sensory issues coming into this webinar, or if you have a child with sensory issues, learn about their individual needs so you can better understand them and advocate for them. There are also so many resources support out there. There's parent support groups, we have great occupational therapists, psychotherapists, pediatricians, all with special training with this population. And there's options in school for assistance. You want to provide children with a sensory-rich environment so that they get sensory exposure, as well as a place to go that's calming for them if they become distressed. Try and make things as predictable as possible and use organizational tools like calendars, planners, and make these clear to the children. Like I said before, if it's just a young child with them, be sure to advocate for their needs. It's hard for people to understand what's going on, and so often they're just seeing the external behavior, maybe the aggression, the avoidance, and not seeing what's going on inside. So it's great if you can help educate others about what's going on. Any activities that your child can participate in that would promote a sense of mastery is great. So if they're good with running, have them be on track. If they're great in art, be sure to have them do drawing outside of school. Anything to help build their esteem and make them feel more confident in their abilities. Again, recognize the strengths of your child. Bring it to their attention. Help them see it too. Like I said, these children, we want to build up their self-esteem. And lastly, for other people who work with children with ADHD, anxiety, OCD, and Tourette's, and other disorders I mentioned that are commonly comorbid with sensory issues, you want to assess and look out for these difficulties because they are more common than you realize. So here are some great online resources. This is the Sensory Processing Disorder Foundation that Dr. Lucy Miller is the director of. And here are some other great sensory organizations. And here are some of the resources that may be useful to you. And that I got that much of my information comes from.
Are you finishing here?
Yes.
Yeah, okay. I wasn't sure if you had another slide coming or not. Okay, thank you. We've had a couple questions. I'm going to start right away with people inquiring about slides. And yes, we will make the slides available to everybody who has attended the webinar. So the information, particularly the sources and all that, Kelly will make sure you get a copy of the PowerPoint. Okay, so I'm going to start right off with questions. Thank you, by the way, Dr. Miller, for the presentation. So I have a question about at what age are you talking about diagnosing a sensory processing disorder? Can it be as young as 4? And if so, like who's diagnosing that? And you know, who would that be, the pediatrician, or what specialist would you see at that age for a child that young?
That's a great question. There's actually specific measures for infants and toddlers with sensory issues. So even you know, younger than the age of 1, you can diagnose this. It's ideal to go to an occupational therapist. This tends to be their specialty. You want to call ahead and find out because occupational therapists may specialize in different age groups. but they'd be the one to go to get a really thorough evaluation. Though there are a lot of pediatricians that can also diagnose a sensory processing issue, it's not always their specialty.
So a diagnosis or some evidence of notice of it could come initially through your pediatrician, but then you'd be looking for an occupational therapist after that.
Yes, yes, but you can go first to an occupational therapist as well if you want more of an immediate thorough evaluation.
Okay. All right. Has there been any research regarding sensory processing and the neurological disorder complex motor stereopathy?
That's a great question. I'm not sure about that, but I will definitely look into that, and we can post that information on the blog.
Excellent. Thank you. And the last half of that point is, you know, if there is, or what the effective therapies might be. So anything you could add to that would be great. What intervention method would you suggest for children who are sensitive to sounds? Could you talk about that a little bit more?
Okay. It depends how they're sensitive to sounds and to what noises. So if they're oversensitive, in the sense that they're getting overwhelmed and stressed by noises, which is a very common thing, you'd want to work with a professional to do some of the exposure work, gradual exposure. So let's say loud music is very stressful. They'd start off with soft music, and then each day it would be played a little bit louder and a little bit louder. You could make it even like a game, that like how loud are you able to, you know, handle the music, or when you sit with it, we can do something fun after. If it's like specific noise, like sirens and alarms, that you would work to, you know, be able to tolerate have the child be able to learn to tolerate for brief periods of time that would be longer and longer. If they're undersensitive, that they're not stimulated enough by noises, that's when you want to have them briefly play loud noises to get them stimulated.
So where are you looking then in that example for a child that's understimulated by loud sounds? Do you wonder if they have a hearing issue there, or is?
Yeah, I mean, these children, you definitely, they might come off as having an auditory processing problem, so you want to look in to see if, you know, have them go through and get an auditory processing evaluation. But they would come up as still getting the information. They're just not having that much of a behavioral response. They're more apathetic to loud noises.
And these intervention methods, they would depend, of course, on the age of the child also, correct?
Yes, correct. There's a lot of different factors, and that's where when I show this, I recommend not just trying anything, but really working with a professional to make sure you're getting at the individual needs of the child.
Okay. What strategies are available for, in this case, a 5-year-old boy with autism who constantly puts things in his mouth? He has a chew tube available, but he mouths everything.
Yeah, there's a lot of different things that can be done. Again, you'd want to collaborate with ideally in a situation that would be great for an occupational therapist. You can, you know, either have them have like an alternative, something that they could, like something like gum or something that they could chew on instead that's more appropriate. And then they can get rewards when they do that, or if they can go periods of time without chewing on things, they can get rewarded. It's something that you, or if they could squeeze something instead of chewing on something, so doing an alternative, they can get rewarded for that. There's a lot of different interventions you can do.
Okay. Have a question about a 6-year-old boy who is upset by certain loud noises, especially other children yelling. he cries, bangs his head, and becomes frustrated. So he's nonverbal autistic, but he refuses to wear headphones. So could you give any suggestions here that might be helpful?
Yeah, again, it's hard without a thorough evaluation. The child needs to definitely want to consult with the individual, with an occupational therapist to get at their individual needs. But there are gradual exposures you can do with giving rewards for when they're able to tolerate noises. So you wouldn't start off with throwing them, and with this type of work, throwing them in a room with noisy children, but maybe tolerating the sounds of one child's voice for a period of time, and then two children's voices, and then have them be a little bit louder, getting them more and more used to it.
Okay, all right. How do you deal with, in this case, I'm not sure how old this child is, but how would you deal with an older child? How would you teach an older child to deal with smells that they have no control over? And in this case, the question is posted as, such as a sibling passing gas. Now, in some instances, I don't know, I might think that the siblings were just beating up on the, trying to make a case of this and have it not be anything. But I'm sure in some instances it really is something. So could you give any suggestions about that?
Well, I mean, there's a couple of things. If they're getting emotionally distressed, they can be taught different relaxation skills to handle that. Whether it be, having thoughts that they can say to themselves. And then on the other hand, are doing deep breathing to get them starting to feel relaxed around that kind of sensory information. Or on the other hand, they can also start, going out there and having foods, trying all different foods with different smells, and getting used to exposure to all different types of smells. That might be some ways around it. Okay,
so maybe a trip to the zoo is in order.
Yeah, that too.
The birdhouse or something at the zoo, yeah.
The more with these issues that they can be gradually exposed to things that they're anxious around in fun ways, as well as, at the same time having, skills to knowing how to cope with the resulting negative emotions, whether it be having like a place they can go to calm down or escape the smell, or being able to do some breathing and get relaxed and say things to themselves like, I'm going to get through this. The combination of both being exposed and being able to be in control of their emotional response is key.
Okay. We had a suggestion that was posted, and I'm not sure what question it was with regard to. So I'm going to mention it here because maybe you can tie it to whatever the question was, but this individual that answered or posted this comment said that they are an OT, but I don't know how, exactly what they were replying to. But they mentioned compression garments, such as Under Armour and weighted vests can be very helpful. So could you address that a little bit, but I'm not sure what the context might be.
Okay, so children who like deep pressure and find it relaxing, there are things like weighted blankets and weighted vests and a lot of other tools that they can wear or cover themselves with that can be very soothing to these children. Doesn't work for everyone, but if it's a child or adult that happens to be more seeking of deep pressure or heavier touch, those can be very useful.
Okay, and that kind of answers their sensory needs then, I guess, in some ways. Yeah. I have a question about school setting. In in school setting, we're told often by treating therapists that they don't work on sensory issues in a school setting. So how can we, and I'm assuming this is apparent, but I'm not sure, how can we ensure that students obtain support for the sensory processing issues in school? Yeah. So can you talk about that a little bit?
Yeah, that's a great question. So with a child you want that has special needs, of course you want to be in communication with all the different professionals. So the therapist, the teacher, the OT, the parents, all in communication. So the parent can let teacher know certain strategies, as well as maybe the school psychologist or anyone else in the child study team, some things that can be helpful at home that they could use at school. So I've had kids who benefit from things like being able to squeeze silly putty, or they need to chew gum, or they need a calming space where they don't get sensory input. And if that can be incorporated into almost like a behavioral plan in school, then that's a way that it could get through. Or you could just informally be speaking with teachers and get permission for them to bring certain sensory tools into the school that they can use.
Okay. Another question about school. What intervention method would you recommend for children who are sensory seeking and are easily distracted during structured activities? So this individual gives an example. A student who struggles to stay on task with gluing because he's distracted by applying the glue to his hands and fingers. So he likes that whole thing that goes on with the glue, but it's not the point of the process.
Yes, yes. So what I would do, I'd set aside bits of time that he has to be on task. Let him know, okay, for the next 2 minutes, I want you to use a paper, put the glue on the paper and paste it in this way. And then you're going to get 2 minutes, or like 1 minute, that you get to play with the glue. And then after that, you get 2 minutes that I want you to work on the activity. So going in and out where they can get bits of the sensory information, sensory stimulation, but they also, have periods of time where they have to be on task. And then the sensory stimulation becomes a reward for them completing the task.
Okay, so what do? You put a timer on their desk and, give them their 2 minutes, or 1 minute? Would you do it that?
Yeah, you can do it that way.
Huh, okay. All right. Does a neurologist play any role in this diagnosing, or is it, if your child happens to be seeing a neurologist, I'm not sure if this is already part of an ongoing program that a child is in with a neurologist, but would you necessarily take a child you think have auditory processing issues or sensory issues to a neurologist?
I think the occupational therapist would be the primary professional, the key professional that you would go to with this. There are some neurologists, especially those that specialize in Tourette's and other disorders that are commonly associated with sensory processing issues, that have more knowledge about sensory problems, but that's not always the case. Neurologists have all different specialties. So, but an occupational therapist, this is typically what they address. So that would more likely be your key person.
Okay. I can see a lot of people having this problem. Could you talk a little bit about gradual exposure for young children who cannot tolerate haircuts?
Yeah, that is a very common one. Well, there's a couple things you can do. You can start off, I think it would have to be, of course, like I said, it depends on the individual child, but there can be, especially if it's a boy and they have shorter hair, you can do it in brief periods of time where they actually at home are able to tolerate like a small area being cut of their hair, and then they get a reward for tolerating that, and a lot of praise. And then they have to, the next time, handle it for a little longer, and maybe it can be, because you don't want half your head shaved and half not, broken up in pieces throughout the day, and they get rewards for sitting through it for multiple periods of time. And then there's other things too that you can go along with it, where like they can wear like a weighted hat for some children before they go in for a haircut. For some children that can be helpful too. So any way that you can like break it up into instead of into smaller periods of time and have those rewarded, that can be helpful. And if you can give them some sensory input beforehand, for some kids, like a weighted hat can be helpful too.
Does it seem to make any difference whether the child goes to like a hair cutter or you're trimming their hair at home? Is that any difference one way or the other?
Well, I imagine they may be more comfortable with a parent, but for some kids who tend to be in a cycle of tug-of-war with their parents over arguments, sometimes it's more stressful at home. It depends on the individual child.
Okay. Okay. Whoops, I just lost my question. Here it is. Is there a way to help children who are overstimulated visually? Could you talk about that a little bit?
For that, yeah, I think like a sensory diet plan would be good, again, with gradual giving them small bits of information, such as little bits of light for brief periods of time. Also having, if you're going to go someplace that's very sunny or there's a lot of bright lights, you can provide them with sunglasses that they can wear so they know that if they get overstimulated, they can use those.
Okay. I think we've probably got time for one more. How would you help a teenager with severe tactile sensory issues when she refuses to see anyone in the psychiatric field and refused OT after just 2 sessions?
Yeah, I mean if it's a young child, you can do a teenager.
Yeah.
Yeah, so I mean with a teenager they have more choice and they can refuse these things. You can work directly with, you can speak with a therapist who specializes in parenting work to see if there's anything you can do to get the teen more motivated and on board with things. But unfortunately, this is a time where they can, refuse things, and you can't force their hand into this, like you could more easily with a young child.
Yeah. Yeah. Would you develop a severe tactile sensory issue as a teenager, or is that something that probably was a longer time coming?
There's very limited research on the development, but I mean the average age that, from what I've seen in research, that parents notice these things is when the kids are 5 years old. It tends to happen early on.
Okay. All right, and there's one more. It's from a teacher that I think is worth calling attention to that we could fit in. So, as a teacher, what should I do if one of my students is having sensory issues that aren't being addressed or treated?
Sorry, could you repeat that one more time?
As a teacher, what should I do if one of my students is having sensory issues that are not being addressed or treated at home?
Oh, that's a really good question. So if you're concerned about the child, take note of it. If there's an occupational therapist there at the school, you can consult. That would be a great person you can consult with. Also speak with a school psychologist about different things that can be done, and definitely reach out to the parents. Be open with them about what you're seeing. Anything, you can put them in touch with the occupational therapist or school psychologist at the school if you've been in touch with them. I think the clear thing about that is being in communication with everyone involved with this child and their sensory issues so that everyone can get on the same page and be on board with helping them get support.
So who would manage that then if you've got that situation? So you've got the teacher, she brings in an OT to observe the child and so forth, and then managing that going forward, you have to get the parents on board then.
I mean, it depends on the school system, how it works. If it's each school system has different protocols for communicating. Oftentimes this may happen through the child study team. There may be a school psychologist that can coordinate this as well. Or perhaps the occupational therapist, if there's one there, may want to call the parents directly and let them know what they're seeing.
All right, but the school psychologist then probably would be a good resource in that particular situation. Yeah, okay. All right, Dr. Miller, thank you very much. I'm going to wrap it up here. There are some questions left that will appear on the blog, and you will take care of those and get to those over the next few days. So at this point, I'm going to say good night to our audience and turn this back over to Kelly for a wrap-up.
Thank you for joining our webinar on making sense of sensory issues. There is an exit survey which we need everyone attending to fill out. The webinar blog is open now and available for the next 7 days on the NJCTS website for any additional questions that were not covered in tonight's presentation. That website is www.njcts.org. Also, an archived recording of tonight's webinar will be posted to the site. Our next presentation, Transitions from High School into College, will be presented by Dr. Andrew Lee and is scheduled for April 15th, 2015. This ends tonight's webinar. Thank you, Dr. Miller, for your presentation, and thank you, everyone, for attending.